Hi guys, Dr. H here, your source of musculoskeletal care, and in fact your source of osteopathic musculoskeletal care. I'm an osteopathic physician. I've talked about this before. I even did a whole video on comparing MDs and DOs. I didn't touch on that too hard. I was more interested in comparing someone who does a lot of hands-on manipulation like myself to a chiropractor. But I did touch a little bit upon the difference between MDs and DOs. That's not really what I wanted to talk about in this particular video. Recently, osteopathic medicine has come into the media spotlight because the White House physician is a DO, and this, for whatever reason, was focused upon with this most recent hospitalization of Donald Trump. Well, this new spotlight on DOs has really brought forth some interesting commentary from the world of the internet. Some very, very negative towards DOs, some often obviously very confused as to what a DO is, and then some that are very positive towards DOs. In this video, I want to discuss a particular article that was published in The Atlantic. I believe the title of that article was "Trump's Doctor Comes from a Uniquely American Brand of Medicine." This article would be an example of one that I think was very much trying to be positive towards osteopathic physicians. However, there were certain things in the article, certain wordings that bothered me, and we'll talk about those later. And then there are just these narratives that I think are constantly getting recycled when it comes to trying to characterize osteopathic physicians. First and foremost, I think characterizing osteopathic physician, particularly in 2020, is a little bit of an exercise in futility anyways. There's so much similarity between our allopathic colleagues, the MDs, and osteopathic physicians, DOs, that it's difficult to distinguish them at this point in time. But nevertheless, there seems to be this renewed interest in trying to give osteopathic physicians this unique character. So let's talk about that. Alright, again, so for this video I'm just going to be kind of pulling some quotes from that article. I'll read them out loud, and they should be beneath me down here as well, so you can read them too. And anytime you're reading something, it always is filtered through your own cognitive biases and your own way of thinking. And so maybe I'm misinterpreting some things, and so this way you get to see the quote as well and kind of make your own opinion. So the first quote reads, "While MDs may specialize in ever more complicated fields, many DOs are proud generalists, and they more likely serve patients' most basic health needs as primary care doctors." So I do think the point that quote was trying to make is true, and the data confirms this. DOs are more likely than MDs to go into primary care. Now, for the purpose of research and data collection, primary care has been defined as family medicine, pediatrics, and internal medicine. The point, though, I do want to make is again, yes, DOs are more likely than MDs to go into a primary care field. But if you look at the data, 56% of DOs go into primary care. Yes, that's technically a majority. But that means 44% specialize. There are still tons of DOs who go into specialized medicine, and it's becoming more and more common. The fact is that a lot of this narrative seems to try to push this idea that DOs are only really generalists, as the article mentions, or I would say primary care physicians. There are a ton of them that are primary care physicians, which is great, but I don't want people thinking that if they go to see a specialist, they'll never see a DO. It's just not true. Again, slightly under half of DOs go further and specialize. So along the same lines as this narrative of all DOs are primary care docs, if you read this article, or if you read other articles, you would probably get the idea that you're really only going to find DOs in rural areas. I believe the quote in the article was, "They are especially prevalent in rural settings." That's not quite accurate. Yes, again, you are more likely to see a DO in a rural setting than an MD, but that's because you're more likely to see a generalist or a primary care doctor in a rural setting than a specialist. And as we already established, yes, DOs are slightly more likely to be primary care docs compared to MD colleagues. Alright, so this next one might get me in trouble a little bit. Let me just read the quote to you first. "DOs believe that their holistic approach distinguishes their practice from that of allopathic doctors." That quote that the author wrote isn't necessarily wrong. There are certainly DOs who believe that, and in fact it's a major part of the AOA's marketing campaign for osteopathic physicians, is how we treat patients as individuals, that we look at the whole patient, mind, body, spirit, and that we're very holistic compared to our MD counterparts. This is a narrative that I think really needs to stop, for reasons, least of which it's kind of offensive to my MD colleagues, right? Seeing a patient as a complete person, not just an illness, that's not being an MD or a DO, that's just being a good doctor, right? That's what it means to be a good physician, is treating an individual and taking into account all the factors of that individual when managing their health or managing a disease or an illness. One of the things that I will give the article credit for is it pointed out a particular study, although it kind of backtracked on what it said later on, but pointing out a particular study that was actually done to see if there was a difference. And I think the only thing mentioned in the article was they didn't find a difference in terms of how long doctors spent with patients. Actually, going to that article and reading it, there's some other things too, like the level of counseling received, how likely patients are to come to see their doctor for preventative care. All these things, all these metrics were the same. This next one is an example of kind of what I'm talking about. Like, it was a blurb. Well, let me just read it to you first. Osteopathic medical schools are still seen as inferior to allopathic ones, and many students apply to DO schools only when it's clear they won't be getting into an allopathic one. There's no citation, there's no link you can click to see research for that. It's just, I guess, an interpretation of what people think, and it seems like a very, very unnecessary blurb to stick in an article, particularly one that's trying to have a positive slant towards DOs. In the past, it may have been true, and I mean deep past, that it was much easier to get into DO school than MD school. Nowadays, that's just not the case. And for good reason. MDs and DOs have equal licenses, equal scopes of practice, equal responsibilities. And so if you're going to have that shared onus, you have to have equal training. You have to be equally competent to do these things. Now, where there is a little truth to this is if you look at the numbers, yes, if you have a lower GPA or a lower MCAT score, you're probably more likely to apply to a DO school than an MD school. So yes, if you look at the applicants' data, it is a little lower than if you look at the applicants for MD schools. But if you look at the matriculation data, meaning the people that these schools actually accept and matriculate, the data is not very, very different. So for DO schools, I think the average GPA score was a 3.53. The average MCAT score was a 504. For matriculated MD schools, that GPA was 3.56, so 0.3 of a point higher, and an MCAT score of 505, so 1 point higher. They're very, very similar. The fact of the matter is, it doesn't matter if you graduated from a DO school or an MD school, you're going to go into residency. Let's say you go into residency for surgery. By the time you're done that residency, you're going to practice probably identically. A large portion of that article was dedicated to talking about how there's very little evidence for these osteopathic manipulative techniques, this OMT. And that's not entirely wrong. Again, I found the wording to be very strange for a supposedly positive article on DOs, but yes, I'm not going to go into it too much here because it would take a longer time than I want to spend in this video. Maybe I'll make it a separate video. But any kind of hands-on manipulation technique, bodywork technique, whatever it may be, is very difficult to research well. So there's a lot of things that go into making a study a good study. And it's not like there are great studies out there showing OMT doesn't work. There's also not that many great studies out there showing that it does. It's really, the problem is there's just not great studies. And so yeah, that's something that the profession has to work on. And any profession that uses bodywork, physical therapy, chiropractic, massage, whatever, should be trying to dedicate and invest more resources into getting really good quality studies out there. I agree with the author that there certainly isn't great research behind OMT. What I found more interesting was, again, how it was worded. It reads, "But at this point, the most compelling evidence for the continued practice of osteopathic medicine are the studies showing that, in certain cases, there's no significant difference in patient outcomes, whether they're managed by a DO or an MD." I don't even know what that's trying to say. For one, they're not talking anymore about OMT or osteopathic manipulative techniques. Now they're just talking about osteopathic care, whatever they're defining that to be. I assume just care you get from a DO. And then the "in certain cases" is very weird to me. I don't know what they mean by that or what they're trying to insinuate through that. They mention studies, but they don't reference anything in that particular paragraph. There's no link you can click to get to any kind of research. It's just pretty much saying that the care you would get from an MD or DO is the same, which I would, again, hope it would be, because we're treating patients the same. If you see an osteopathic surgeon to get your gallbladder removed versus an MD surgeon to get your gallbladder removed, again, it's probably going to be the exact same treatments, exact same procedures. So I'm not entirely sure what that language was trying to emphasize. I have a very hard time reading it in any way that can be positive. It continues on referring to this osteopathic physician that the author was discussing it with, about how that sounds like a low bar. And yes, that is a very low bar. I mean, it's the bar, right? It's not even that much of a low bar, it's the bar. There's a certain standard of medical care, and yes, whether you're an MD or DO, you should be meeting that standard. That is the bar of competent medical practice. But again, I just don't know how to read that in a positive light. All right, so sort of just to summarize, the point of this video was to address some of these narratives about DOs that I think just keep getting recycled over and over again. I just don't think are really helpful or accurate anymore. And again, I'm not trying to bash this one particular article. I've seen these narratives everywhere. I was just using this article as an example because I think it just came out very recently, and despite the fact that I think it was trying to put DOs in a positive light, I think it was trying to, it still was using these sort of old, outdated, beaten up narratives to label anyone who's an osteopathic physician, or to label the profession in general. Rural, primary care / generalist, I think was the term they used in the article. Couldn't get into MD school. Uses techniques that have no evidence behind them. Again, for an article with a positive slant on osteopathic physicians, I think these narratives all need to go away. Not the least of which is the other one, which is suggesting that DOs are in some way more holistic and treat you more as a person than MDs do. That definitely needs to go away. So that's all I wanted to talk about in this video. I wanted to make it sort of just a quick commentary to help, hopefully, create some positive change the way we think about these two different professions of MDs and DOs, and hopefully we'll eventually get to a point where if the White House physician's a DO, nobody cares. Alright guys, slightly different video today. I promise I'll get back to some musculoskeletal stuff here in the near future. In the meantime, keep moving.